This is the Summit County Public Health Student Bloodborne Pathogen Training video. It's important that anyone coming to Summit County Public Health as an employee, intern, or student, and may be in a setting where there is potential exposure to blood or other potentially infectious body fluids, watch this bloodborne pathogen training video. Following the video, you will be asked to sign an attestation statement that you watched the video and understand the principles to decrease bloodborne pathogen exposure and what to do if you receive such exposure while at Summit County Public Health. If you have any questions about the material shown in this training, please contact Dr. Margot Ermy at 330-283-6380 or at mermy@schd.org. Here are the objectives for the presentation. What is a bloodborne pathogen? How bloodborne pathogens are acquired? What are the risks for exposure? How you can protect yourself from exposure? And what to do if you're exposed to a potential bloodborne pathogen. Bloodborne pathogens are organisms that are only found in blood and other body fluids. They are not transmitted in respiratory secretions, air droplets, or stool, and cannot be caught through casual contact. By other body fluids, we mean other potentially infectious materials. These will be covered in the next slide. While there are infectious agents that can be passed through stool or respiratory secretions, bloodborne pathogens are not unless these materials are grossly contaminated by blood, that is, blood that can be seen. This is a list of other potentially infectious materials. These are considered other potentially infectious materials for the transmission of bloodborne pathogens. Fortunately, most of these are only encountered in hospital settings or specific situations. Saliva during dental procedures is listed because of the contamination of saliva with blood that occurs as a result of the dental work. Hepatitis B, hepatitis C, and the human immunodeficiency virus are going to be the bloodborne pathogens that we will be covering. There are other germs that can potentially be transmitted through blood exposure, but they are not commonly acquired this way. Standard precautions, which will be covered later, will decrease the risk of other diseases. All these agencies have guidance as to what should be done to protect healthcare workers from acquiring bloodborne pathogens. OSHA has set out the requirements for training, vaccination when appropriate, personal protective equipment, environmental controls, workplace practices, standard precautions, and post-exposure follow-up protocols. Persons who need bloodborne pathogen training are identified by job classification and potential risk to bloodborne pathogens by job duties. Here are the categories of employees at Summit County Public Health who need bloodborne pathogen training. The scope of the bloodborne pathogen standard that was developed by OSHA is not limited to employees in these jobs. The hazard of exposure to infectious materials affects employees in many types of industries and is not restricted to the healthcare profession. Every workplace where employees may be exposed to blood or other potentially infectious materials as part of their job duties must have an exposure bloodborne pathogen plan. The purpose of the plan is to minimize exposure to and protect employees from bloodborne pathogens and other infectious agents. All employees who could be potentially exposed to blood or other potentially infectious material must receive initial and annual training on bloodborne pathogens and the agency's exposure control plan protocols. A model used to understand the infection process is the chain of infection, a circle of links, each representing a component in the cycle. Each link must be present and in sequential order for an infection to occur. The importance of this model is that there are a number of areas in this chain where an intervention can occur to decrease or prevent a disease from occurring. Prevention of bloodborne pathogens employs strategies that intervene at multiple points in the chain. The most common way that bloodborne exposures occur is through inadvertent needle sticks. It is estimated that 600,000 to 800,000 needle stick injuries occur each year in the United States. Other methods include cuts from contaminated sharps, which mean any contaminated object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes and exposed ends of dental wire, and contact of broken, which is cut or abraded skin with contaminated blood. Exposures may occur without a puncture of the skin. They can occur with exposure of the mucous membrane, such as the mouth, eyes, nasal passages, or throat, with contaminated body fluids or blood. Very few exposures result in a bloodborne pathogen disease. It depends on the susceptibility of the person exposed, the pathogen involved, and the method of exposure. Most of these diseases are also passed sexually, which should not be an issue in the healthcare occupational setting. Hepatitis is defined as inflammation of the liver. It is very nonspecific and has both infectious and non-infectious causes such as viruses, alcohol, drugs, or other metabolic disorders. Signs and symptoms of hepatitis include fever, decreased appetite, nausea, abdominal discomfort, malaise or tiredness, yellow eyes, and skin. These symptoms may vary in acuity or be absent. The signs and symptoms of hepatitis do not identify the cause. It takes a history, a physical, and diagnostic workup to determine the etiology. Hepatitis B and hepatitis C are two specific bloodborne pathogen viruses that can cause hepatitis. The average time for symptoms to occur after exposure to the hepatitis B virus is 2 to 3 months. 85 to 90% of people will recover without any problems and become immune. 10 to 15% of people will not clear the virus from their system and become chronically infected. They will always have the virus with them. 1.2 million people in the United States are estimated to be chronically infected with hepatitis B virus. 20 to 30% of the carriers were infected as children. It's important to realize that 30% of people infected with hepatitis B virus will have no signs or symptoms whatsoever and not even know they've been exposed or infected. Chronic carriers have an increased risk of cirrhosis or liver cancer. There has been an effective vaccine against hepatitis B virus since 1982. It's typically a 3-dose series and no routine boosters are needed. Hepatitis B virus is 50 to 100 times more infectious than HIV. It can survive outside the body for 7 days or longer. For a person who is susceptible to hepatitis B, the risk of coming down with hepatitis B after being stuck by a needle contaminated with hepatitis B positive blood ranges from 6 to 30%. Hepatitis C virus is a totally different virus from hepatitis B. The average incubation period is 6 to 9 weeks, but can be as long as 6 months. The majority of people infected with hepatitis C do not recall having any symptoms of hepatitis. 75 to 85% of people who are infected with hepatitis C become chronically infected. They do not clear the virus from their system and can infect other people. Tests for hepatitis C were not available until 1992. There is no vaccine against hepatitis C, but now there is effective treatment. The hepatitis C virus may survive outside the body and transmit infection for about 16 hours, but not longer than 4 days. Hepatitis C is the primary reason for adult liver transplants. The estimated risk of getting infection with hepatitis C after a needle stick or cut exposure to the hepatitis C infected blood is about 1.8%. It is unknown what the risk with mucous membrane exposure, but thought to be much smaller. Another bloodborne pathogen is the human immunodeficiency virus. Someone exposed to HIV will develop antibodies 6 weeks to 6 months later. This disease affects all ages, races, sex, and sexual orientation. Most have no symptoms when initially infected or very mild flu-like symptoms. There are more than 1.2 million people living in the United States with HIV. This virus is not very hardy and can only live in dry environments for a few hours. There is no cure or vaccination for HIV, but medications have slowed the progression to AIDS. The average risk of acquiring HIV after a needle stick or cut exposure to HIV virus is about 0.3%, or 1 in 300. It is much less if the exposure occurs to a mucous membrane. HIV attacks the human immune system, specifically the CD4 counts. This will cause the CD4 count to become low, and people become more susceptible to diseases, which are called opportunistic infections or AIDS-related diseases. Once the opportunistic infections or AIDS-related diseases occur, the person moves from just being HIV infected to having AIDS. There are other risk behaviors, such as those listed on the slide, that can possibly expose a person to bloodborne pathogen infections. Not all bloodborne infections in healthcare workers are the result of an occupational exposure. Healthcare workers can and do participate in behaviors that can put them at risk for bloodborne pathogen diseases outside of the work setting. There are many reasons why the risk of infection varies. It relies on the specific germ, type of exposure to the blood and body fluids, amount of blood involved in exposure, the amount of pathogen present in the blood or body fluids at the time of exposure, and exposed person's immune status or susceptibility. We have talked about the risk of getting hepatitis B, hepatitis C, and HIV via needle sticks and mucous membrane exposures and have seen how much they vary. People who are immunocompromised from a medical condition or medications may be more susceptible to an illness if exposed. The amount of pathogen in an infected person's blood or body fluids can vary depending on the person's condition and any treatment he or she may be receiving. Prevention of bloodborne pathogen exposure is a combination of strategies. Remember the different points in the chain of transmission model that was covered earlier. These are three particular strategies: engineering controls, personal protective equipment, and workplace practices. Examples of engineering controls include sharps containers, biohazard warning labels, needleless syringes, proper disposal of medical waste, and accessible sinks and eye wash stations. Engineering controls include those modalities that decrease the likelihood that a person will come in contact with contaminated materials. This slide lists the items that an employee can wear in order to put a barrier between himself or herself and contaminated materials. These are called personal protective equipment, or PPE. It is important to tailor the type of PPE to the specific situation being covered. Workplace practices are routine procedures used on the job to reduce exposure to bloodborne pathogens. It is very important to consistently follow these practices. Consistency is the key. Do not take shortcuts, particularly when you look at hand washing, housekeeping strategies, and standard precautions. When talking about hand hygiene, you can use alcohol-based sanitizers or soap. Alcohol-based sanitizers are useful when soap and water are not handy. However, hand washing with soap should always be used if the hands are visibly soiled with any material, such as blood or other body fluids, or taking care of someone infected with specific hard-to-kill organisms, such as Clostridium difficile. It is important to use soap after every 4 to 5 uses of hand sanitizer to clean the hands properly. All facilities should have routine cleaning procedures for surfaces, equipment, and use products that will kill the majority of germs and viruses in the work area, including bloodborne pathogens. Phenol germicidal detergents, such as Lysol or bleach, are very good at cleaning bloodborne pathogens. It's important to read the directions to make sure that the product that you use will kill the germs that you are concerned about. Standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, through non-intact skin, including rashes and mucous membranes. These measures are to be used when providing care to all individuals, whether or not they appear infectious or symptomatic. It's important to be consistent. Do not have a bias, positive or negative, towards people because you know them or have a preconceived perception of their likelihood of having infectious disease. These may cause you to alter your standard precautions and put you at risk. Again, consistency is the key. Treat all human blood, any body fluid containing blood, or any other potentially infectious body fluids as if they were to be infectious with HIV, hepatitis B, or hepatitis C. As I mentioned earlier, every agency that has employees that may be exposed to blood or other body fluids must develop an exposure control plan. They also must provide personal protective equipment, offer and provide hepatitis B vaccine to employees at risk, plan and offer training at initial assignments and annually, determine the job classifications that involve risk of exposure, maintain training documents, and assure confidentiality. The purpose is to eliminate or minimize employee exposure to bloodborne pathogens. So what should you do if while working at Summit County Public Health you have an accidental exposure to blood or other body fluids? The first thing is do not panic. Apply immediate and appropriate first aid, including washing the area with soap or water, or if it's a mucous membrane, rinsing copiously with water. Assure the work area is safe for others. Notify the clinic staff so the appropriate supervisor can be contacted. The supervisor will follow the protocols in the Summit County Public Health Bloodborne Pathogen Exposure Control Plan in order to get you evaluated and appropriate follow-up be started. These are items in the Summit County Public Health Exposure Control Plan exposure packet. The supervisor will go over which forms need to be filled out and how you will get the evaluation and follow-up that you need. The supervisor will arrange for the evaluation of exposed student, intern, or resident. According to the CDC guidelines, testing is dependent on many factors, but may include baseline testing for HIV antibodies, hepatitis B virus antibodies, or hepatitis C antibody testing. Follow-up testing and treatment is dependent upon the results of the source patient testing, which Summit County Public Health will be responsible. Results are confidential and shared only with the medical director and the individual personal physician if desired. Summit County Public Health will work with the affiliated hospital or educational facility from where the student or intern or resident came on the appropriate follow-up. It is your responsibility to read and understand this information and ask questions if unsure of procedures, to use the proper personal protective equipment and follow standard precautions, to report any exposures, follow the procedures in the event of exposure that are explained to you by the supervisor, and to complete the recommended follow-up after an exposure. We want you to have a safe and worthwhile experience at Summit County Public Health. It is important for you to be an active participant with the strategies to keep you safe. If you have any questions, do not hesitate to ask the people with whom you work or contact Dr. Margot Ermy, the Medical Director at Summit County Public Health.